projector just for education purposes. So this is a really nice feature to have this information and communication. And last, but certainly not the least, partnering up with Aegate very early in the process gave us the opportunity to stand for pharmacists, because we didn't want systems that increased the cost for pharmacists or which interfered with the workflow of the pharmacist. And Aegate really quickly understood these very important points for community pharmacists. Pioneering work has been done 2008, 2009. Community pharmacies in Belgium, more than 50% of them, are using for years and years this authentication services. And we really serve as a role model when we go talk to the national stakeholders. You see from left to right, we have the National Drug Regulatory Authority. We have Pharma.be, which is the national FPA, if you can call it. You have Febelgen, which is the national EGA, and OFACO, which is the Federation of the non-APB pharmacies, the chain pharmacies. How do we work together, Aegate and APB? For a number of different aspects. First of all, we as an association have direct access to the Aegate interface. We code information in the interface that helps pharmacists getting the right message on the right products. For instance, recalls. We are at the, we initiate the recalls. We input the information in the Aegate system the moment the decision for a recall is made. So that the next second a pharmacist scans a product, he gets the alert that the product is substandard and shouldn't be dispensed to the patient. Also new product information. With our own product database, we have a delay in getting recent information to the patient for a number of reasons. If there's important information on a new product which enters the market, scientific information, other information, we can use the Aegate channel to have in a split second the information with the pharmacist, so pharmacist is never obliged to dispense a product without some extra information. These counseling messages on product information, on adherence, on good use of the product, we create them, but some of the messages are coming from industry because they know their products best. They know what product is necessary for the pharmacist to give to the patient. That's why Aegate offered the opportunity to the pharma industry to have messages on certain products. Not just any messages. For our market, we didn't want commercial messages, but as an association we negotiated that with Aegate. If in your market commercial messages are more accepted, then might be a possibility. Just discuss this with these people. So what we arranged with Aegate is that all messages coming for industry are first screened by a panel of 20 community pharmacists which are using the system. A panel that screens the messages for, is this message really necessary? Is it adding value? Can I find this information somewhere else? These are a few parameters the panel is using and advising Aegate and the industry to have only top quality messages. And we made a few mistakes in the early days, but we've paid the learning fees, and now for over 5 or 6 years, all the messages that are coming on are really appreciated by the pharmacist. We get monthly reports to follow the implementation, to follow the activity of pharmacists using the Aegate channel. This is a recent one. I'm not sure what month it was, but look at the numbers. Almost 2,500 pharmacists actively scanning, and this number has been quite stable for a number of years. So this is not just a pilot with 200 or 300 pharmacies. This is really thousands of pharmacies on a daily basis using the system. Some other numbers we're getting on the number of products in the database, but what's more important for me, that's the numbers I always look at when I get this monthly reporting, is what did the Aegate system prevent in terms of quality, in terms of safety. And when we look at the numbers, we can see that there's hundreds of packs being stopped by the Aegate system which were about to reach the patient. Packs that were recalled, packs that were expired, or packs that were almost being expired. So this is really showing that apart from the FMD, apart from the authentication, these extra services, extra information in the Aegate interface is really helping patients. It's really helping pharmacists. And then a critical success factor, if you ask me, the response time. We're all in a hurry. We don't wish that another system interferes with our way of working. Back in the old days, 2006, we had response times of almost half a second. And then, as more and more pharmacies came on the system, response times only went down. So I'm not an expert. I'm not sure how Aegate managed to do all this. But the important thing is that for years and years now, we have response times of about 200 milliseconds, which is too fast to be noticed by a pharmacist. So this is very crucial statistics. Then we have, as an association with a number of community pharmacists, we have quarterly meetings with Aegate, where we talk about feedback we get from our members, where we get from Aegate some feedback on the FMD, on the delegated acts, on the stakeholder positions. We do communications to pharmacies together, and we shape together future projects, future services, future activities. It's very important that we get this opportunity as an association to shape the interface, to shape the product as we wish it to be for our community pharmacies. Experience, this is just one or two slides to show the way we've arranged ourselves with Aegate to handle certain events. A multiple scan event is typically an event where a unique code is scanned more than once, making the code not unique, but the code is coming back in the same pharmacy or in other pharmacies. And then we have a whole procedure or how to go through with this, but the best way to show this procedure is by an example, a quite recent one. This is the end of last year, where there was a multiple scan alert on the system, a unique number, which turned out to be not very unique, which might give an indication of this might be a problem with this product. It was being scanned on the same day, the first few hours of the working day, between 9 and 10 in the morning, in 5 different pharmacies. So that's the red buzzer going off with Aegate. They started investigating. They contacted APB, they contacted the manufacturer, and very soon the manufacturer was very happy to have this information, and they investigated, and it seems that the same batch, it was a genuine batch, but it was all labeled with the same unique number, same number, which was not unique, because all the packs in the batch had the same number. Then it was discussed between the pharmacy association, with the reimbursement authorities, with Aegate and the manufacturer, what would be the best option to do so. And then measures was taken. Manufacturer, the not commissioned products were relabeled. The ones which were already dispensed could stay dispensed. There was no quality problem with them. So all this was managed within the day. By the end of the day, it was the issue was resolved. Whereas without the Aegate system, it would have taken 2 months before reimbursement authorities noticing that dozens or hundreds of pharmacies were all filing for reimbursement the same number. And that could have had major impact on the pharmacies, not getting reimbursed, on the manufacturer, and on the system as a whole. This is one of the numbers you saw in the table, 815 recalled packs which were stopped by the Aegate system. If it wasn't for the Aegate system, these 800 packs could have reached the patient, possibly causing harm to the patient. Shaping project services together brought us to public health campaigns. We've run for a number of years with Aegate. We've run them on flu vaccination, we've run them on compliance, we've run them on antibiotic awareness, and this is just an example of messaging we do around the European Antibiotic Awareness Day, which is, I think, the end of November. On that day, or within a week, I think, we ran a campaign and we informed pharmacists by mail, by a website, by publishing articles. But what we really wanted to do is, when the moment a pharmacist dispenses an antibiotic, to give some extra information. Actually, it was stickers, labels you had to put on the box. It was part of the campaign. To make sure pharmacists were following this campaign, we had for a number of days this message. You're scanning an antibiotic, please do not forget, we're running the campaign this week, just put a label on the box and give the information to the patient. Using the image that national authorities were using that week on TV spots. So we have this synergy of elements, people looking in the street, seeing the image, and getting these pharmacists to give the same message. As a conclusion, from the beginning, APB definitely supports the Aegate system because it doesn't impact the workflow of the pharmacist. This is very important. And I suggest for your market, you go talk to Aegate to together identify the right place, the right person, the right moment to have the integration, to do the authentication, to add other services. They're the specialists, they can help you to identify that moment. It needs to be fast. People do not want to do extra things. So for us as a Belgian community pharmacy, free of charge for the members, for the pharmacists, need I say more? It brings added value. For our market, was recall warnings, expiry date warnings, counseling messages, public health campaigns. Those were the things that definitely in a pre-FMD period were very important to have pharmacists eager for the system. And at last, the simplest system, user-friendly, flexible. If you have any doubts, talk to Aegate, they will convince you of it, but still effectively increasing the safety of all our patients. Thank you very much for your attention.